let's move on to the second topic, period complications. Dr. Ho, can you list out some of the common period complications and explain to us more about each of them?
Okay, so we will go through dysmenorrhea. So dysmenorrhea are typically described as menstrual cramp, which can occur before, during, or after the menses. It can be divided into two types, so primary dysmenorrhea and secondary dysmenorrhea. Primary dysmenorrhea typically starts once you attain menarche and occurs before the menses and starts to relieve as your menses occurs. As you age and along the cycle, the pain will get lesser. These are due to the prostaglandin, one of the chemical that released during the menstrual cycle, causing the pain. Whereas secondary dysmenorrhea happens typically before, can be during the menses, and does not really relieve the menstrual cycle. So the most common causes of secondary dysmenorrhea are endometriosis, which is the implantation or presence of the lining of the womb outside the uterus. Can be anywhere in your pelvis. So these linings are similar to the uterine lining. So they respond to the monthly hormonal changes, and they also bleed into the pelvic cavity, of which that causes the pain during the menstrual cycle. So for menorrhagia, it is described as heavy menses. As we mentioned earlier, a normal menstrual cycle or abnormal is what you perceive whether normal or abnormal. Okay, or we can quantitatively about 4 to 5 pads a day. If one required to change pads more frequently, for example, every 2 to 3 hours with multiple big clots, flooding, overflowing, that's definitely not normal. It will be advisable to seek medical consult if you experience this menorrhagia to rule out other underlying causes, like for example fibroids or abnormal uterine lining. It is not uncommon to have certain cycles with heavy bleeding in girls, young girls who have just attained menarche, especially those with the irregular cycle. So there's again two types of amenorrhea. Amenorrhea is defined as an absence of menstrual cycle. So primary amenorrhea occurs in girls who had not attained menarche by age of 14 without any secondary sexual characteristics, or by age of 16 in those who have secondary sexual characteristics. In women who has or girls who already has menstrual cycle, it is defined as 3 months in those who has a regular period, or 6 months in those who has an irregular period. So it can be caused by, again, divided into two, structural and also anatomical or even or hormonal dysfunction. So that will require further evaluation, including the blood test, clinical history and examination, and also imaging to help to determine what are the possible causes.
So that's it for period complications. We will now move on to taking care of ourselves, physically and mentally. Firstly, Dr. Ho, a very important question: how can we maintain menstrual hygiene?
Okay, so maintain menstrual hygiene is actually very easy. So there are various brands of menstrual products in the market. Most commonly used are sanitary napkins, or what we call pads. Other products available are like tampons and menstrual cups. Well, sanitary napkins actually varies in sizes, the absorbency, the material, whether they are wing or without wing, whether they are centered or without sense. Some girls may have heavier bleeding, while some girls have lighter bleeding. So it's important to choose the right size of the sanitary napkins, or big enough for you not to worry about leaking, so you can carry on your normal activity without worries, or small enough for you to feel comfortable with the pads or even the tampon or the cups, right? Center pads contains deodorants, so one may want to take note that these deodorants may cause irritation to the vagina or the skin at your private area, and cause some allergic reaction in some girls. We would recommend changing the pads about every 3 to 4 hours, even if with a very light flow. This is to prevent odor building up and also bacterial growth. Yeah, so for example, each time you visit the ladies, you can just change it to maintain the hygiene. So whereas for during shower time, you can just use normal water. You do not need to have any feminine products to specifically wash it. But some of these products may cause irritation to your vagina.
So other than physical health, our mental wellness is also very important during this period.
Definitely.
How is our mental health affected during menstruation and how should we deal with it?
Okay, so mental health are usually affected in girls who experiences period complications, for example, menorrhagia, dysmenorrhea more commonly, but some premenstrual symptoms. So premenstrual symptoms can be in mood symptoms or even physical symptoms. So these girls may experience some anxiety, depression, irritability, mood changes, or even swelling, breast pain, headache. This may affect the mental health, of which if one experiences these symptoms in a consecutive cycles, meaning that every single cycle during the menses, I would advise to seek medical help before they progress into more severe mental disorder.
How should we deal with these symptoms?
Okay, so mood symptoms typically can be managed by exercise and relaxation techniques. For example, yoga may help. Any exercises that actually build up the healthy immune system and also a healthy lifestyle may help. Dealing with stress are very important as well, because more often than not, these are also a mixture of these symptoms are also a mixture of stress from work, from studies, for example. So stress releasing relaxation technique or methods are also will be able to help to relieve this. Some studies have shown that yoga or even aerobic exercises helps in relieving the physical or affective symptoms of the premenstrual symptoms.
So will a change in diet help with this also?
There is no clinical scientific evidence with regards to diet, but I suppose balance and healthy lifestyle, these symptoms, mood may be balanced and less likely to have all these problems.
So that's it for our interview with Dr. Ho. Thank you so much. We hope the information about the menstrual cycle, period complications, and how to take care of your body were useful to you. If you want to hear your questions being answered, follow us at The Monthly Affair and stay tuned to the next part of the interview.